So I'm Carrie Kollias. I'm a pediatric orthopedic surgeon. I'm certified by both the Royal College of Physicians and Surgeons of Canada in orthopedic surgery, as well as the Royal Australasian College of Surgeons in Australia. So I've worked in both countries as a attending surgeon. So I personally experienced burnout about 7 years ago when basically I had been a surgical pioneer in Canada for a specific procedure and was the first one to do it and had been carrying on for numerous years. And basically it became a funding issue, and from my perspective, in terms of implant cost. And other people wanted to start doing it. And then in my particular province, although it had been approved widespread in Canada at that point, basically, essentially the funding was pulled. And from my perspective, this was a very small portion, but very high meaning part of my surgical practice. And it was personally devastating, actually, to the point where I actually ended up leaving the country and was offered work elsewhere in Australia. So we know that meaning and purpose are protective against burnout, and we know that, for instance, from a Mayo Clinic study of internal medicine specialists, that if you can spend 20% of your time doing things at work that you consider to be very high value, that's highly protective. And so for me, even that probably wasn't even 20%, it was just so important. And so that was removed. It was, certainly became emotionally exhausting. I experienced the cynicism and said, like, I gotta make a move here because this is not how I want my life to be. So in the end, that was very positive. Surgery is a very intense profession. It requires very significant discipline. There's very high standards, and I think that certainly in surgery, I would say that the larger part of medicine is probably further ahead in this topic in terms of the data than surgery, but there's definitely increasing data, which I've also tried to contribute to. I mean, one of the things that I did when I actually moved down to Australia, which we did a similar study to what we did in Canada and surveyed all Australian orthopedic trainees to look for distress using the same tool and some other demographic factors that we looked for in terms of protective features for protecting against burnout. So I think we understand a lot about burnout in literature in healthcare, so the data that's been collected, and other industries probably aren't as advanced in that area. The pandemic has amplified this as a problem. So one of the biggest reasons for people leaving their jobs and resigning is burnout. And that became very clear through the pandemic. The term the Great Resignation, which was coined by a business professor from Texas, Anthony Klotz, and just talks about this huge exodus of people saying, this isn't worth it anymore. I'm not getting equal out of what I'm putting in. So industry, for instance, in the corporate world has become very interested in this area because it's actually really affecting their bottom line, and it's acknowledged now, which before it was sort of, it wasn't really tangible. So, I mean, the fact that we've been talking about this, we've been researching it, we have significant knowledge in this area over a 20-year period. This can be really applied in the business context, which is a very new discussion. It's a very important discussion at the moment, and a lot of it is sort of in the post-pandemic and pandemic era. This is not new discussion for us. This is many years of talking about it and trying to find solution. So I think the learnings from medicine, where we have a lot of data in those areas, and we can actually pivot and apply, I think, a lot of that to the business and corporate world and industry as well, because we have data. I mean, data is power, and I think measurement is only the first step. That doesn't actually help you solve the problem, but unless you actually know how bad it is, how can you even take steps to solve it? There are challenges with the response bias in terms of depending on, say, you're the CEO of an organization and you're doing a employee well-being survey. If only 10% of your employees are responding to that survey, you might have a bit of a problem there. So, but if you in a leadership position, you should want to know how your employees are tracking. And if they're not tracking well, then the question is, why are they not tracking well? And what do you need to do about it to make them track better? Things that we know, for instance, that work to prevent burnout. And when we think about that, 6-7 years ago, we used to talk about, personal resilience and meditation and go do some yoga and things. And I think if anything that's happened good out of the pandemic, it's that people recognize that has there is a role for that, but that is not the guts of what keeps people from burning out. It's actually system improvement. So we know that things like fair and supportive leadership is protective. We know that mentorship there's evidence for that. Shared decision-making, enabling autonomy, work group cohesion is very important. And for instance, in surgery, when you actually don't have that, actually patients suffer, your outcomes are worse, people get hurt. So I think the stakes are so high in medicine, and I think those concepts are very applicable to the business world and other industries as well.